Hi. Did you know that 90% of children are born to hearing parents? My name is Iris Johnson. I am currently an American Sign Language interpreter in an elementary school and a high school, K through 12. I have an EIPA score of a 4.0, which qualifies me to work in the state of Michigan. I have worked in a deaf and hard of hearing program for 5 years now. I started 3 years ago prior to being an interpreter as a signing parapro. So I was supporting in rooms with deaf students who needed an interpreter or just needed supports. I also worked in an immersion room, which I'll talk about a little bit later. And now I'm an American Sign Language interpreter, and I'm going back to school to get my master's degree in deaf education to become a deaf ed teacher. What is deafness in children? So like I mentioned in the beginning, 90% of children are born to hearing families, and a majority of those times, many of those families want to fix their child. They see their deafness as a sickness or an illness and a fault in their child, and they would like to find a solution to fix that and take care of it. While some families look at it as fixing, other families look at it as a blessing because it gets to provide them with a community and a support system that is very unique. There are some options for reinstating or amplifying hearing in a child or even adult. There are cochlear implants which attach the cochlea nerves on the ear, and so then sound is transmitted correctly into the ear. There is not a surgery, but an addition of a hearing aid. So any sound that a child or adult may have, it will just amplify the sound, sometimes through bone conduction or sometimes just through hearing aid devices that sit on your ear. There's one more option, which involves doing nothing. Some families look at this as risky, while other families think it's the best choice they could have ever made. It allows for the child, if chosen to do it from birth or anywhere around elementary or middle school age, to be involved in a deaf community. They don't have any devices. They are fine just the way they are. They can and will do things regardless of a lack of hearing. 2 to 3 out of every 1,000 children has detectable hearing loss, which means that 2 to 3 out of every 1,000 kids go through this with their families. Their families may have an idea of what they would like to do, or feel as though they aren't sure. And people will come up to them, tell them their opinion, and then they have to decide what to do from there. Within deaf education, there is the situation, the problem, the great debate. Many parents, when finding out that their child is deaf, have questions, thoughts, concerns, and don't know what to do. Maybe the question is, do we use a device to assist, such as a cochlear, a hearing aid? Do we get the cochlear surgery? That is a life-changing surgery. You cannot go back. Once that surgery is done, if the body accepts the cochlear implant, the attachment to the cochlea, then the process of adjusting the sound and allowing for that student to use it for the rest of their life is possible. But sometimes the body decides that it does not want the cochlear implant. It rejects it. There can be infections, swelling, sickness, dizziness, nausea, and it's just sometimes too bearable with so little input of the hearing that it isn't even worth it. Maybe the parents feel like they should just let the child decide later. Maybe it's going to be the child's decision when they are 12, 13, 14, 18. As time goes on, the success rates of the cochlear implant do get worse, but being able to say that you gave your child that decision and they could choose to get a cochlear implant, just do a hearing aid, or do nothing is very powerful. That gives the child the power once they hit that age of understanding. Whereas if the parents do it, that's a total possibility, and maybe it's successful, but then later on, the child could feel frustrated with their parents or be accepting. You never know. Regardless of the decisions that are made, the impact and perspectives will be there for the family and children for the rest of their lives. Whether it goes well or not well, they will have an opinion about what they decided to do. Their child will either have a cochlear implant, and some deaf people will see that, a hearing aid, and some deaf people will see that, or Nothing. And no one will see that until they put their hands up to sign. What's deaf education? Well, deaf education is the teaching to students who are deaf or hard of hearing, and there are a few different options of that, and places and placements and involvement. The first one would be total communication, which is an immersion room where you have one teacher who is fluent in sign language, hearing or deaf. Though if you have a deaf adult signer who's fluent and has that degree, that is great. They're able to provide cultural insights and access to the language and some really good information for deaf students. But also if you have a hearing individual, such as myself, who is going back to school for a master's degree in this, totally fine too, as long as they are making sure they are consulting and have the right information with deaf adults. Sure, it's better than nothing, right? So we have an immersion room, which is where the teacher who is fluent in sign will sign every subject: math, science, history, social studies. Often this is seen in just elementary and middle school, so then when they get to high school, they can go out into their classes mainstreamed and be with their hearing peers and get that same level access. Sometimes with the immersion room, once a child shows progress or steady understanding of an at grade level topic or subject, they will then be sent out with their mainstream class. So if a child in first grade is on par for first grade math, they will be sent out for the first grade mainstreamed math. That's up to the teacher's discretion, both the immersion room teacher, the general ed teacher, and the parents. Totally up to them. They can decide what they would like to do. Second option is mainstreamed in a general ed classroom, which means, as most people would probably think when they hear of a deaf student in a building, there's a student in the classroom, gets preferred seating in the front of the classroom, what's best for them, but then they will have an interpreter. Sometimes it's a one-on-one. Sometimes if there's 3 students in first grade, there'll be 3 students with that one interpreter. Sometimes they'll split it up. It just depends. But that is where they will go around all day, stay in their grade level classroom, and they are on par, doing great, don't need any assistance in that other language of sign. Another option would be school for the deaf. In the United States, there are currently 49 residential schools, which means you stay there over the full week and then you go home for the weekend, while there are 47 day schools. It's just a very typical wake up in the morning at your house, go to school, come home after school. The school for the deaf is a great place for deaf individuals. There is community, understanding. You're learning more than just your topics in sign language. You are learning how to communicate at lunch, how to communicate at recess, just conversation. Anything that someone might go through is happening in sign language, and that's a great place for deaf individuals. Also a safe place. Sometimes deaf students just need to be somewhere consistently for 5 days in a row, deep in this language, and this is a great place for that. Another option would be oralism. This doesn't tend so much with any of the education through the deaf side of using sign language, but this is more where they suggest and appreciate that sign language isn't used. They will focus solely on the communication through speech, and there generally is no sign language allowed. There are also other modalities involved, which are systems, just ways to communicate. They don't have a grammar structure, a community, a language with it, but it's just systems to communicate. And those are also available for deaf individuals and students. What are the benefits of deaf education? Well, there's a language. When you have this deaf education, you are becoming fluent in this language. You are understanding anything that we learn as hearing individuals speaking English or Spanish or any other language. You get to communicate with others in that same community who go through the same exact experiences as you. Maybe someone treated you differently because you're deaf and you don't have a deaf person in your family to talk about that with, but you have other deaf individuals in the community. There are also great opportunities to be just deep in language, and they're sometimes called language-rich environments, which are generally the immersion classrooms or programs that are focused fully on sign language. It's language all day, every day, and that can be so beneficial for consistency with students, on top of the fact that it's beneficial for them to understand subjects in their language that they are using all day. Helps their language as well as their academic skill and understanding. Generally, we hear and see that behaviors diminish. If a child can communicate, they don't have a reason to be screaming 12 times a day, generally. They don't have a reason to be violent. Once they're given this form of communication, a lot of those big feelings are going away. They may have those big feelings still, but we're not seeing them the same way. We're not seeing them through tantrums. We're not seeing them through throwing chairs. We're not seeing them through biting their classmates. They can communicate their feelings. We can then navigate and go about how to deal with those through language. Having sign language and deaf education is a great way to support English growth. That is something that we focus very hard in our program on. English is everywhere, regardless of if you speak it or not. You need to know how to read it, to understand it, and get the differences between sign language and English. And knowing sign language gives you a base of a language to then be able to understand English using that other base language. Like I mentioned before, just the community, a great atmosphere, a great group of people around you supporting you and pushing you to be the best that you can be. Language deprivation. Language deprivation syndrome is actually when individuals don't have a language even with their age level. So sometimes individuals or students or children are adopted and not given language until 12. They're deaf. No one could communicate with them. They can't understand hearing. That means they don't have 12 years of language. Whereas a hearing baby, we know both inside of the womb and out of the womb, is hearing everything. Hearing words, hearing language, hearing communication. So when that baby is born, it often already recognizes the names of its mom, its dad, family, siblings, friends, and that is something that a deaf baby does not have. Though a deaf baby can learn by incidental learning, which is the process of seeing those around you signing, having conversation, fixing the broken sink. That baby watching that could already see how a problem is solved through that communication, can notice the signs, and then over time, just as we learn how to speak and talk, they can learn how to sign. Babies babble in English, babies babble in sign. It's a lot of, and that's okay. That means their brain is processing and developing, and they're understanding that regardless of if this makes sense, what's happening here, they know this is how they're going to be communicating with others in the future. And that is great progress for the brain and for the student. The language deprivation impact has quite a few concerns and negatives to a child. The first one would be that it does have, as I mentioned, the cognitive development. If this child isn't getting language until, honestly, right after birth, that is putting them back more and more to be able to learn their skills, see the growth, and often help them and support them in the academic pathways to graduation from high school and secondary education. As I mentioned previously as well, language deprivation can be seen in behavior. If a student just cannot communicate their feelings, their thoughts, simply that they want to tell you that they love you, we're going to see that in behavior. Anyone's going to see that in behavior. And often that can be taken as that student has some other things they need to be working on. But in reality, while that may be accurate, there's probably a lot of other language situations occurring. Let's give them that language. Let's put them in a classroom that uses sign language. Let's watch them grow and then be able to communicate with that language. And one of the really last strong impacts that we see with language deprivation is the social understanding. Students don't know how to communicate with their friends, with their family, because they don't have the language to do that. If they can't do that, they can't socially interact with individuals hearing or deaf in the community, in the store, at school. They don't know what that looks like. They aren't able to ask questions of how to approach that appropriately. Therefore, they aren't sure what to do. Giving them that language, helping to navigate the language deprivation that they may already have, and supporting them with that language is incredibly important. This is a study done by BYU. It is just kind of a quick reference if you want to take a look. The red is the deaf individuals and the blue is the hearing individuals. So it gives you a general idea of the education gaps with deaf individuals who, as I was reading the article that was posted along with it, have some form of language deprivation, or were given language late, or just in general, there are struggles being deaf in the education system. There are other bills and laws being passed to support that right now, but this just gives you an idea. So there's a 6% gap in high school. There is a 12% gap in some college, bachelor's 15% gap, and then bachelor's plus, master's degree, doctorate 5% gap. That means that these students in the red all have an educational gap. I would think probably very strongly due to the lack of education that they got in sign language, and I'm sure some language deprivation that they are experiencing and having. That's why deaf education is so important. That's why it's so fundamentally important and strong for our deaf students. If they aren't able to learn in this language, if they can't even learn this language, look what we're going to see for them in the future. Post-high school, post-secondary, working out in the field, they need to be able to communicate in a language they feel comfortable in, strong in, and know they have a great community in. I have a reference list here as well, just from all the information that I got. Thank you so much for taking some time to watch this, and I do hope that you learned a bit about deaf education. You understand now when you see that deaf student with an interpreter what it might be like. I hope that together we can work to make sure that they are getting the right access to language, the right access to understanding, and that they are able and on par to navigate the world ahead. Thank you.